Wouldn't extra taxes cost less than paying for insurance for healthcare in America? Yes. Yes, it would. The larger the insurance pool, the less you have to spend on overhead due to economies of scale. There's a lot more reasons why literally every other developed country has socialized medicine. But that's a big one. One thing not mentioned here, but Dan Price tweeted recently, part of the reason that the elites spread so many lies about universal healthcare, and pretty much anything that benefits workers, is that it keeps us dependent on them. If you have insurance through your job, then you have less bargaining power than if you have the same insurance no matter what. Even if your insurance isn't the greatest, it's still cheaper than not having insurance at all. It's another boot on our necks. Yes, this has been studied a dozen times. And healthcare costs less in every single-payer system than it does in the USA. A few things though. Americans are deeply skeptical of our government, in particular, its incompetence. As an example, we spend close to $1 trillion a year on our military, and have not won a war since 1945. It's reasonably possible we could fuck this up too. Arguably. Some companies are willing to invest in speculative R&D simply because they know that the big American market will let them recover their costs. So what if they only get a 30% margin in the UK? They can get a 3,000% margin here, which justifies a lot more risk. If you take away America, things like the recent cure for hepatitis C might not make sense to any company. Globally, there is more. But thought I might give you some perspective. I do not agree with the above, but I sensed you wanted to hear the talking points. Of course it would, but those insurance companies will peddle whatever it takes to convince Americans they don't need to switch and thus destroy their profits and current business models. Here are some simple points I've seen on both sides. Pro: you are renting a space for a party that costs $100. If 100 people chip in, it's $1 per person. Con: a reasonable concern. I don't know if you drive, but putting the gov in charge of medical would be like the DMV. If you've been there, it is trash in America. The U.S. healthcare system's yearly costs are a bit over $11,000 per citizen. Of that, private insurance and out-of-pocket is about $4,000, while the government tax-funded part of it is $7,000. Although the public systems average by far the most expensive patient groups, the average developed country's healthcare system costs $4,000. Public and private, expensive and cheap patients, covering everyone, for everything. The most expensive and generous nations, Western Europe mostly, average about $5,000–$6,000 per citizen in taxes for their UHC systems. That's not exceptional. That's not unusual. That's done matter-of-factly even by nations not normally thought of as well organized. When you look at the population, the U.S. overspending compared to the average developed nation comes to over $2 trillion. Compared to the most generous systems, it is about $1.5 trillion. With a T, for comparison, the U.S. military budget is about $700 billion. $7 trillion per year. Just to give some scale to people. It would be cheaper, but healthcare system have two ways to do it. 1. Country gives certain amount of money to hospitals, based on population or need, like there is in Poland or France. 2. After visiting to a doctor, hospital sends bill to the country like in Sweden. I let you guess WGHCH is more efficient. For clarity's sake, yes it would. Yes. Also, I think we actually pay for healthcare out of our taxes anyways. On top of the extra bullshit we pay for care insurance. And no, they wouldn't even have to raise taxes to do it, just shift money around. Anyone who knows what you have to do to continue to receive grant money, especially in military, Spending knows exactly what I'm talking about when I say the money's there, lol. But we are also talking about the same people who are mostly against raising the minimum wage to $15 because, I quote, "It's not fair that I only make $18 an hour and now they get $15 because they are too fucktarded to realize the economically disenfranchised are not the ones who set their pay rate, lol." Listen, poverty is morally coded in this society and a whole fuckload of people are going to have to die out first before majority catches common sense.
Yes.
You would also have government step in and limit costs for medications and services. So yes, your taxes would increase, but the reasons people don't like it are usually elsewhere. One example is a long wait times. Here's an article pre-COVID about Britain's single-payer healthcare system. https
www.forbes.com/sites/2019/04/1/Britain's-version-of-Medicare-for-all-is-collapsing/.
equals 7F 5812 CE 36B8. It's free, but some people are left waiting for doctor's visits many months out. This may not be a large issue for something less serious, but the long wait times can be bad if you have cancer, where timing matters a lot. This is just one example from one country, but it does show that a tax-funded system is not without issue. You might say that if we could do it right, then everything would work, but do you trust that the U.S. government could make it work? The ability for a system like this to flourish might change as presidents and House, Senate majorities go back and forth between parties over time. At the end of the day, you have to do your research and decide what you like more. Reddit tends to be left-leaning, so a lot of people will attack the idea of privatized healthcare. But you shouldn't blindly take their word for it. No healthcare system is perfect, so you have to decide whether or not universal healthcare is the answer is for you, and vote for people that represent your views. Economist here. Actual expert in public policy analysis. In fact, thing with taxes is they have a direct impact beyond the money raised. This is called the excess burden of taxation. You can wiki it. It's long and complicated. The short version is that taxes take out of the economy about twice the revenue raised. So paying for healthcare via taxes would really only double the total cost. It wouldn't save any money at all. Yes, but no middlemen would be able to get rich siphoning dollars. For 80% of Americans, definitely. Only the super rich would pay more for national healthcare than they currently do in insurance premiums, and unfortunately the super rich are the ones in charge.
If you enjoyed this video, please check out our playlists full of similar content. Epicaricast is like doom scrolling for your ears. Please like, share, and subscribe.